Anxiety, violence, hunger. These are just some of the indirect effects the corona crisis is having on children around the world. Although they are not as hard hit by the virus itself, they are among those worst affected by the measures to contain it. Children's playgrounds across the world normally look like this. But the corona crisis has made them look like this: empty and closed. Children are not allowed to come and play here during the lockdown. Initial data suggests that children suffer from serious COVID-19 infections less often than older people do. But that's not the whole story, because children are among those most at risk from the effects of this outbreak, with a serious impact on their well-being and their mental health. Some drop out of school, some are beaten by their parents, some have to go hungry because they can no longer get meals at school. So, which children are facing the biggest challenges, and what needs to be done to change that? The UN is warning that the COVID-19 outbreak is affecting children in 4 main respects: education, health, poverty, and safety. 177 countries have imposed countrywide school closures in recent weeks. That means more than 1.2 billion children and youth across the world have been stopped from going to school. Exams have been postponed or canceled. To help students cover the material they were supposed to learn in class, many countries have rolled out distance learning programs. But that's a challenge to developing nations in particular. Only 30% of low-income countries have introduced national distance learning platforms. One of those countries is Kenya. Short lessons for primary and secondary school students are being broadcast online, on TV, and on the radio. But Kenyan households face a host of problems that keep many children from accessing that content.
And then we still have power outages. This is Kenya, man. So if, let's say, there's no power, you miss your class. So I don't know how we're going to look at the accountability if we were to look at all this time. Yes, there was the government airing the curriculum on TV and online. So how do you explain you didn't catch up? You can't blame someone when we don't have a television at home, or we have one and maybe someone wanted to do something different.
On top of that, data packages for viewing educational videos online can be expensive. Some children don't have access to the internet at all, and even where there are e-learning possibilities, they are rarely catered for children with learning disabilities and special needs like autism.
The routines have changed immensely, right? Meaning that we have more meltdowns at this time because children cannot understand why my routine has been disrupted. Then they're not getting therapy. So either that's speech or occupational therapy. There is the support system that they depend on to keep them calm enough for them to be able to study.
All these hurdles may hinder children from getting a good quality education, an education that is vital for the foundation of their future lives. Although the coronavirus itself appears to be less deadly for children, it does have indirect effects on the health of many young ones. Many polio vaccination programs have been halted worldwide. Measles immunization programs have also been put on hold in many countries. That's partly because parents are not taking their children to be vaccinated due to fears of the virus, and also because border closures have led to a vaccine shortage. Plus, the outbreak is affecting children's nutrition. 368 million children who rely on school meals now have to look for food elsewhere. In Puerto Rico, social workers and teachers have had to step in to feed hungry families.
Me enviaron la foto de una nevera vacía y pues obviamente rompí el toque de queda, me llevé mi licencia de trabajadora social y a las 7:30 yo estaba aquí entregándole lo que tenía.
It's not just children's physical health taking a toll. Experts warn that their mental health can also be affected by the pandemic. Children are separated from their friends, from their teachers. They're not allowed to see their relatives. Their movement has been restricted, and routines they were accustomed to have changed completely.
So once those things are disrupted, that can have damage on the child's brain. And that can impact them not just in the short term, but also in the long term if we don't act fast.
A recent study conducted by Save the Children in mostly Western countries showed that almost 1 in 4 children is struggling with anxiety while living under lockdowns, social restrictions, and school closures.
And what I'm most concerned about is a level of, possible depression increasing in children, because what I'm hearing from many of the children is not much is going right. I mean, they are really more of the pessimistic thinkers.
The effects of the pandemic are seeing many children spend more time with their parents than they used to. Stresses within the family, whether about the disease itself or about financial worries, for example, can easily transfer to the children.
So for parents, they first need to understand what stress are they under and how are they communicating that to their children. It's not always through words. It's through children hearing things or understanding your expressions, your facial expressions, your tone of voice.
Parents can support their children's mental well-being by equipping them with skills to strengthen their mental health. One of the skills psychologists suggest is resilience.
So resilience is so important because it's the opposite of feeling helpless and hopeless, which is depression. Resilience is focus on what you can control and focus on what's going right, not just what's going wrong. Not to exclude what's going wrong. We don't want to deny what's going wrong.
Across the world, businesses have been put to a halt and millions of parents have lost their jobs. The global economy is shrinking, and that leaves children in low-income families facing hunger, poverty, and desperation. Such families often rely on parents that work in the informal sector. They have little or no savings, and they may live in countries where there is no financial aid from the government. According to UN estimates, the economic impact of the corona crisis could force up to 66 million children to fall into extreme poverty. Most of these children were already living in families that had to struggle financially. Other families, like here in Delhi, have been suddenly cut off from their previous source of income.
एक टाइम का भी खाना नहीं आता जल्दी से। लॉकडाउन के चक्कर में ज़्यादा खरीदना चाहता है तो नहीं मिल पाता, और राशन भी यहाँ पर दुकान में भी ख़त्म होता जा रहा है, पैसे भी नहीं है। तो मम्मी पापा यहाँ पर मजदूरी करते हैं और बेलदारी का काम करते हैं, और यहाँ पर काम चलता था वो भी बंद है, तो फिर नहीं हो पा रहा।
When parents from poor communities go through a financial shock, they may make decisions that drive their children further into poverty and exploitation. Some marry off their young girls, some send their children to work to increase the family income, and some abandon their children altogether.
We've had an incident of a mother leaving a child at the police station. Another mother left a special child by the roadside with a note. That tells you, like, people are having a really, really hard time, and they do not have the right channels of how to get assistance and get help.
Rights organizations believe that governments must step in to help such families so that they are not put in a position where they are forced to endanger their own children.
And we know from past research that cash transfers, for example, providing cash assistance for families who are in need, is one of the best ways of averting child labor. So in Morocco, for example, a project showed that as little as $7 a month per child could dramatically reduce child labor rates.
For most children, their homes are the place where they feel safe and secure. But school closures and lockdowns don't necessarily mean that children are being protected from physical harm. According to UNICEF, most children who experience violence at home are being physically abused by their own caregivers. That means parents or adults that are responsible for the child. Lockdowns make it easier for abusers to hurt their victims.
And now those numbers are only going further and further up. And to compound the situation, cases of child abuse are less likely to be detected. Oftentimes it's teachers who are most likely to observe symptoms or signs of abuse in their students. And that's obviously not happening in the classroom.
With all these dangers lurking, Human Rights Watch urges governments not to use a lack of funds as an excuse to neglect children's welfare during this crisis.
Some of the interventions are not that hard. For governments, even those that have limited resources, making hotlines available and publicizing the phone numbers through television, radio, social media is certainly, an important intervention to make sure that people know that there's some place that they can call.
Parents, activists, and politicians agree that support for children needs to be a joint effort and that it has to be a priority. Neglecting children's mental and physical well-being during the crisis may have a long-lasting outcome.
We know that there are common mental disorders that can easily be managed at the community level by non-specialists. So I think it's not a matter of whether we can do something. I think we can. We just need the resources to enable us to do so, to avoid some of the longer-term impacts.
Is too little effort being put in protecting children during the COVID-19 outbreak? Let us know what you think in the comment section below.